Hello everyone, welcome to US Residency Training and Beyond. I am Dr. Viswanath Aluru, attending physician in physical medicine and rehabilitation at Oxford Health in New Orleans. In this video, we will discuss about admission process. So, one thing you have to understand here is like a difference between doing a consult versus doing an admission. When someone consults you for your expert opinion, you're only focusing on the information that is needed, so like a patient situation or a condition. But when you're actually admitting a patient to your service and you're attending physician, then you have to address all the things in addition to the admission diagnosis, and also any comorbidities and other medical conditions that the patient is already having. So that's the main difference that you have to understand. So you might get admissions from your same hospital, like a different department, or you might admit patients from emergency room, or you admit patients from a post-operative care, or you admit patients from outside hospitals or outside facilities. So there are different situations where patients can get admitted to your service under your attending physician. So that's why it's important to understand where the patient is actually coming from. Say for example, if you were consulted under your attending from an emergency room and you saw the patient in the emergency department, and you discuss that patient with your attending physician, and your attending decided to admit this patient to your service or attending service, then initially you have to write a consult note saying that this is the reason why we were consulted from the emergency room, and then based on your discussion with the attending, we decided to admit this patient to your service for further management of the condition. So now you have to document, you have to do an admission. So the patient comes to your department under your attending service. Now we have to do the admission. In another situation, say you were like an internal medicine resident, and because your rapid response was called and you attended to the rapid response, and the patient needed immediate medical attention or an ICU admission. So you're transferring the patient from another floor to either med surg unit or like an ICU. In that situation also, the patient is like a transfer from department to department. It's also considered as like a admission. And say some for another reason, say if you're a rehab resident and you are getting an admission from the outside hospital to your rehab unit, so the patient presented to the outside hospital, say with weakness, a patient was admitted and treated for a acute stroke. The patient wanted inpatient rehab admission, so the patient is being transferred from outside hospital to your department in your hospital. That's another way you can get an admission from an outside hospital. Say the patient actually present to an outside hospital and got admitted for an acute stroke, but the patient was not ready to come to inpatient rehab to get that intensive therapy. So what they did was, or in another situation, the patient was not qualified by the insurance company for some reason to go to acute inpatient rehab. So the patient was sent to a skilled nursing facility, and now the patient really wants to get more therapy, get more stronger, and wants to go home. In that situation, they requested for like a inpatient rehab admission, and the patient was approved to come to inpatient rehab. In this situation, you're getting an admission, or you're attending is getting an admission from a skilled nursing unit. There are certain situations where, say, patient got admitted to the acute medical service, and the patient needed extended medical care. So the patient was sent to like a long-term acute care or LTAC service, right? Say for like a vent management or IV antibiotics or bed management, whatever it is. Now the patient is actually out of the acute medical situation, and LTAC is contacting you, the inpatient rehab floor, to actually admit the patient for acute inpatient therapy services under your service. In that situation, the patient is being admitted from the long-term acute care unit. Sometimes, say the patient already went to the hospital for like acute stroke or injury, and then went to the acute inpatient rehab, and then got discharged home. But now the patient regressed, there's a functional decline, and the patient or the primary care, contacted the hospital for an acute rehab admission. In this situation, the patient is actually getting admitted from home. So, or for example, say the patient presented to the emergency room, And from the emergency room, the patient was evaluated by surgery department, and they thought the patient needs acute surgery. The patient directly went to the operating room, and the acute surgery was completed, and the patient is now in the post-op department. Now the patient needs to be admitted for the floor for like a post-op management. So in that situation, the patient is admitting from the post-op area or from the surgery directly. So there are several situations where the patient can come to your service for admission. Or say for example, the patient is already admitted to some other hospital, and the attending physician wants to do a transfer from that hospital to your attending to your hospital for like a higher level of care. So that's like a hospital to hospital transfer. In that situation also, the patient is getting admitted to your attending service. So you need to know where the patient is located currently and what's the diagnosis, where the patient is coming from. So once you have that information, then you have to request additional records if the patient is coming from an outside facility, like a hospital or a nursing home, LTAC, whatever it is. You need to get additional documentation, what's going on with the patient in that facility, all kinds of therapies or medications, or how they are managing this patient. You need to have a thorough understanding of the current situation of the patient when you're receiving the patient under your attending service. That's why it's important you have to pick up the phone, call the other facility, talk to the case manager or the floor nurse, supervisor, whoever it is in the admissions department. Try to get the records either by fax or by email, so you have all the information that is needed to understand the situation of the patient thoroughly. And once the patient is on your floor, say if the patient is already in the hospital in a different department or an emergency room or an ICU, so you already have access to those charts. But if you don't have a medical record access in your hospital, then you can just directly go to the department, ask any related information to that patient, because when they're getting transferred, they will come with a discharge medication list and a discharge summary. That's something that you have to review to make sure that sometimes what they do is they change the medications on the discharge day, and then they reconcile all the medications and make additional recommendations on the discharge day. That's why it's very important for you to actually review those discharge recommendations, discharge med reconciliation and discharge summary, to actually understand, okay, what happened, are there any changes that happened on this day of the discharge that needs to be considered when you are admitting patient under your attending service. That's why it's very important to review those documentation like the facility records or the discharge notes or the transfer orders or the discharge summaries, in order to make sure that you are doing the admission appropriately. Because there's sometimes, because of these discrepancies, you might miss things, or you might put some wrong orders or wrong dosages, wrong medications that they wanted to discontinue or change to some other medications. That's why you have to pay really close attention when admitting a patient to your service from some other service. So once the patient is already on the unit, then you have to get as much information as possible from the existing charts, right, or from the outside medical records, or from the patient, talking to the patient directly, or talking to the family member if the patient is not able to provide information, and then do an examination related to the admission. And then you have to thoroughly document everything, why the chief complaint, history of present illness, family history, social history, any social related things, and vocational history, medications, past medical, past surgical history, allergies, what are the diet orders. Especially this is important when it's like a neuro-related patient, like a stroke or a brain injury patient, because sometimes they come on modified diet or they come on tube feeds. You need to know exactly what modified diet the patient was tolerating. If they're on tube feeds, what tube feeding they were tolerating. Those are the most important things. If you're unsure, then you have to contact your nutritionist or speech therapist or other department to actually figure out what the patient can tolerate and putting those orders appropriately. So you have to do admission orders. So you have to figure out also why the patient, you have to put an admission order to admit the patient to your service. And then you have to put in orders for diet, you have to put in medication orders. That's why it's important to cover all the records, old records from other hospital, to make sure you're doing it correctly. So with this, I'm going to end this video. In the next video, we will continue with the admission process. Thank you. I hope you all enjoy this video. So I will see you all again soon. Thank you.